caught her eye. Many of the infants improved in the hospital, but started bleeding again after they returned home.
Use soaps and things like that to clean it up.
The families of the sick infants were interviewed using a 230-item questionnaire to see if they differed in any way from the families of healthy children. All of the homes were tested to see if the pesticides used were the type approved for residential use. And air samples from the homes were also collected. Within days of the investigation, 2 more babies with pulmonary hemosiderosis were rushed to the hospital from the same neighborhood. The total number of cases was now 10.
9 of those 10 were male, and all of them were African American. So this made us start thinking as to whether we were dealing with something related to the genetics of race, whether we were dealing with something that was particularly susceptible in males. Those were in the background of our considerations of still primarily something in the environment was probably causing this.
But if the cause was environmental, why was Brian Mitchell sick while his twin sister, Brianna, was healthy? Both slept in the same room, in the same crib, ate the same food, and breathed the same air.
Here, an infant who had no outward signs of bleeding had had ongoing, low-grade bleeding for several weeks. And yet, at any time, she could have had a stress and she would have bled to death. So this said to us, not only frightening for her, but frightening for the community. How many infants like Brianna were out in the community that were showing no real significant problems? How deep was this iceberg?
As the mystery intensified, so did the fear among parents in Cleveland's East Side neighborhoods. The level of pesticides in the sick babies' homes were all within normal range. And there was no difference in air samples collected from the homes of the sick children than those collected from the homes of the healthy infants.
We want to prevent another death, we want to prevent another case, and we didn't know where to reach out to next. So I think all the public health authorities involved, state, federal, local, were really trying to get together in a think tank and figure out some answers because we didn't have any.
But the data gathered from the questionnaires began to reveal some important information. 7 of the 10 sick children lived in homes with cigarette smokers. All of the sick babies had been bottle-fed, none had been breastfed. And all of the sick babies